So guys, hello. Today we want to talk about two patients here.
Exactly.
He reached with one surgery how much centimeter?
A little over 9.3.
And I did 3 limblengthening surgery, 20 centimeters. So he's a new patient. I'm old patient, old-fashioned patient. And today we just want to talk about the limblengthening surgery. What is exactly limblengthening surgery? Because everybody's talking limblengthening, different doctors, different physiotherapists. But today we want to talk about with our nutritionist Meltem, head physiotherapist Tuba, our head nurse Özlem, and 2 patients. And from the patient and from the team view. So, to be honest, what do you think about lengthening? What is limblengthening surgery for you?
It's basically a surgery that makes you taller.
Okay.
It could be cosmetic. In my case, that's what it was. Or it could be a medical necessity if there is a leg discrepancy. So, and it's actually a pretty easy surgery. It sounds pretty scary, but it's really not. So,
It's easy, right?
definitely.
Yeah.
Absolutely.
Yeah. When we say easy, some people say, okay, why he say easy? It's maybe, business or something like that. No, guys, it's really easy surgery when you do a 100% job and, of course, 100% treatment. Because, when I did my surgery in 2018, unfortunately, I was alone.
Right.
I had nobody, just Dr. Halil. He visited me one times a week. Just, how are you? How do you feel? And I did my physiotherapy alone, my nutrition, pizza, Bella, yeah. And also my medical, when I had pain, for example, just Google, okay, for that kind of pain, is that good? Yes. Because, it was hard for me. And I saw my recovery time was also really late, yeah, that was a big problem. Because, you are happy because you reach your height, but you cannot enjoy it because you cannot walk or you cannot do some activities. And
So true.
but for you, for example, you did the lengthening.
Total different experience.
Yeah.
Absolutely.
Can you explain a little bit your experience, your daily life, for example?
My daily life, before I came here, I was kind of scared because I came here alone. But I didn't feel alone at all. Constantly, people came to check on me, and there is a nutritionist that always gets on you anytime you eat something that is not good for you. They give you like a diet plan that is tailored for you. It's not just a genetic thing that they print out. It's just for you based on your height and weight and everything. Nurses constantly come and check on you. Physiotherapy 6 days a week, and then there is gym. So all the medical necessities are here. And then besides that, there are entertainments too. Like we had like belly dancing, moving. Like a very pleasant experience. It's not just a medical process. It's just like a mini vacation that you'll just leave a little taller.
That's true. And you can even enjoy your journey and meet some new people and your team. But for example, from Monday to Sunday, how long, I don't know, you guys, the treatment, the physiotherapy treatment, or can you explain a little bit, for example?
So in the morning, I wake up, I have my breakfast, and then my physiotherapy usually tell me the night before what time I need to go and see him.
Wow, okay.
But the nurses come usually before just to check on me to make sure I take my medication and everything. And like after I had bandages, they come to check on it to make sure that everything is okay. Even though they told me that I need to take medication and everything, sometimes I forgot, and they constantly come to check on me to make sure, did you take that pill or not?
Wow.
So which was really nice because constantly people care about you. Nutritionist visits you every day, ask you what you ate that day, and give you like ideas of what to eat based on your condition. And then you go to your physiotherapy or the gym, whichever, but you could go to both. The gym is always 24 hours, it's there, and they always suggest to go there. But after the physiotherapy, then I have usually my lunch, and usually there's Wi-Fi, high-speed internet, so I just watch something. Or you can come here, there's like an Xbox 5 and all sorts of entertainment, and people come and socialize too, so you don't get bored. Or you can just go outside and just enjoy the fresh air. And then I just spend some time on my laptop watching Netflix and stuff like that, and then the dinner, and then just go to bed.
You get taller every day, huh?
And you get taller every day, exactly.
Okay, great. For example, your physiotherapy sessions was from Monday to?
Monday through Saturday. Sundays
Wow.
are the days. Yes, 6
Wow.
days a week.
6 days a week.
Yes.
Tuba, I have a question to you. Monday to Saturday was session. Why Monday to Saturday? Is that not too much, or can you explain a little bit?
Physiotherapy, we have two different techniques, also three with the gym. The manual therapy, the exercise therapy, and the important thing, the device therapy. That's why it's not too much, because not every day the manual therapy, not every day the deep massage or so strong stretch. It's different. It depends on the patient situation, patient condition. Because one day is manual therapy, the other days the exercise, the gym therapy, the other days if patients need, the device therapy, the laser or game ready or something. And that's why the 6 days is really so good, because every day he's doing lengthening. Every day is body changing. Every day, the 1 or 1.5, it doesn't matter. It's body needs the adaptation and needs some stimulation from the physiotherapist, from some stretching, from the touching. It's really important. 6 days, it's really so best treatment for limb lengthening surgery.
I have a question to you. Is manual therapy not enough? Or just only manual therapy? Imagine only manual therapy.
Please don't ask anymore that question. No. No, manual therapy has so different techniques, so much different. You can touch the superficial muscle. Of course, some with different techniques like Graston or something. The fascia, you can get relaxed or realize, but for the deep muscle, for the deep tissue, for healing for deep tissue, you must use some different technique. That means the laser or laser, or there's also too many different laser technique. It's also ultrasound or cold, hot massage. It's also need that. Just manual therapy doesn't enough.
But to be honest, I respect your job, because physiotherapy is the most hardest part for this kind of surgeries. But what do you think, for example, imagine he do the lengthening, but he don't have any physiotherapy or not enough physiotherapy, maybe some with special machines, or I don't know. What can happen?
He said this process was so easy. That's why it's easy. You said it's hard, right? Because the physiotherapy really need that you can get taller just with laying down, but after you can't do bending. After your posture gets so worse, it's really need this stimulation. Patient can not do that alone. Never. Also, it's just physiotherapy is not enough. So many patients sometimes going the back country or something, and he's saying they are doing same thing, but I feel not like here. It's also physiotherapy is not enough. You must know the limb lengthening. You must be professional. Sorry, but really you must be professional in that case, that limb lengthening process.
And I can say also something, by the way, because many patients ask about the risk and side effects, complication. So I think it's my opinion, and I don't know what you think about it, but side effects is a different part, risk is a different part, and complication. I don't know what you think about that.
I think so, but it's like very low that I'm not even concerned about it. And I've seen so many patients here, not one of them had any. Like side effect, like maybe you get like a tiny little infection that can be solved with taking like an antibiotic. So it's not even a side effect, it's nothing really.
The problem is, for example, side effects can also happen because of our fault, for example. I mean, our fault, surgeon fault, because this kind of surgery, I say always that, I don't know what you think about that, guys, but I say always you can't get the surgery with the best doctor. I don't know what you understand about best doctor, but imagine a doctor from a president. That's not enough, because limblengthening surgeries is 2 parts. One of them surgeon part, orthopedic surgeon, because he knows he's the bone specialist, but after that you need treatment with professional physiotherapists, nurses, and nutrition. But the surgeon can also can make a mistake, you know what I mean? For example, when he put the nail, the intramedullary nail or precise nail, it doesn't matter. And when you can gain deformity because of the nail entrance, so that means you have bow legs or X legs, and then they affect definitely your health. I mean, your knee joints and something like that. And this is a side effect, for example. But complication, many patients ask about complication. Yeah, complication can of course happen because of from our side or from patient side. But the most of the complication, to be honest, it's happened because of patient side.
Absolutely.
Patient never listen to other patient or to other doctors. What do you think about that?
No, I 100% agree with you. Absolutely. I mean, I've seen so many patients, not one case I've seen an incident that it was like the doctor's fault or the physiotherapy fault. Like, and the most common thing is like tiny little infection, especially with the loan method. I didn't actually have that. I haven't had any complication, but I've seen like, and it's just like like antibiotic ointments, like solves the issue. So I don't even want to call it complication. It's really nothing.
But you always listen to us, right?
Absolutely.
Is
Absolutely.
that true?
Yes.
Okay, I want to talk a little bit about nutrition. What do you think about, is really nutrition necessary?
Yes, it's like 80% of this whole process. It's really effective on bone healing. Of course, there are many parameters that...
Sorry, how much percent?
80%,
Wow,
I think,
okay.
because yes, of course, there are many parameters about the bone effects on the bone healing, but nutrition is one of the most important things. Because with proper nutrition, we can see healing of the bones, also healing of the wounds. We can decrease the risk of infection, and it's really important that's possible with proper nutrition, of course. And of course, the diet should be prepared special for each patient, not a general list for everybody, because everybody is different, needs different. So it should be prepared special for each patient, and we do that with Sam, and we sometimes change his diet. Like for example, since his childhood, he completely refused to eating some vegetables, and sometimes I force him to eat spinach or something like that because it's very beneficial for bone healing, and he ate. And he liked, right?
I did, yes.
Because he liked Turkish foods also. And we see the benefits on the wound, of course, and on the bone healing. So protein sources is really important. Our goal with diet, protect the muscle mass. And that's what happened with Sam. Of course, he lost weight, but all the weight he lost from fat mass, not muscles.
By the way, lose weight. Is that normal during this weight?
It is very normal after surgery, during the lengthening process, because the body spent a lot of energy. Even the patients doing nothing, lay down all days, all weeks, still body spent a lot of energy because of the lengthening. Because there will be like bone formation after surgery. That means body spent energy for growing bone. And of course, the patients getting taller every day. That means the BMI increase day by day because the lengthening, because getting taller every day. So if the patient don't replace the energy with foods that the body spent, patient gonna lose weight. It's very normal. But our goal with diet prevent the loss of muscles. We want to lose of weight from fat. And we measure at last appointment again body analysis. We measure weight again, and we see with Sam all the weight we can protect his muscle mass and all the loss of weight from fat mass. And that's also good for physiotherapists, because if we can protect the muscle mass, physical activity capacity, exercise capacity and performance increase, and we can see the benefits of the physical activity, physical therapy more.
Okay, and what happened if the patient didn't care about the nutrition, to be honest? What can happen?
What can happen? The patient might be infection because of the wound healing, and also the bone is not going to heal. Not union. So it's really important to consuming enough amount of the protein sources, protein-rich foods, also milk and dairy products according to calcium. And for example, Sam didn't eat fish and seafoods and walnuts much, so we use omega-3 supplements for him for better bone healing, and vitamin C supplements because vitamin C also stimulates the collagen production in bones. So collagen is really important for bones. Because we are not in the season, the vitamin C foods like oranges, kiwis, we use vitamin C supplements for him and omega-3 supplements, and we can see the benefits of supplements too. If the patients don't follow the diet with insufficient eating, we see the slow bone healing and also some infection or something like that in wound. Not good wound healing. It's really important about the nutrition. It's really effective. So vitamins, minerals, that's why we suggest always patients eat fruits and vegetables.
Okay, I have another question. With nutrition, we can support physiotherapy as well, or is it just for the bone?
No, not just for the bone. We can protect the muscles. Muscle mass, total body muscle mass. If we can protect that muscle mass, we can make easier that the physiotherapist's job. If we can protect that muscles, the exercise capacity and the exercise performance will increase. So we can see the benefits of the physiotherapy more.
And also we always contact with her because it's really important. So some fruits or vegetables, I'm not sure, but it's also help to muscles relaxing, right?
For example, magnesium-rich foods.
Yes.
We can also
It's also so help. We always contact, okay, madam, please, that patient, it's tight today, and please give something and help to muscle relaxing. Yeah. It's also so important. We always contact.
And it's also important for the general health system, you know, when sometimes the patients don't eat much and the allergy low, then you are gonna open for every infection, not just about your leg, about everything. I mean, your lungs, something like flu, something like that. Or, for example, sometimes the patients got some diarrhea or any systemic problem like that, and we always talk each other like, yeah, hi Tuba, the patient has like some pain like that, what can we do? Or hi, Mertem, the patient has diarrhea, let's talk together, something like this. Then decide together and
his appetite for a little while, and we talk each other, and we start a supplement for appetite, helps appetite, increase appetite, and he said, yes, I can eat better now.
Exactly.
You remember that? You want to talk about that?
Yeah.
First, before I lost my appetite, actually my bone healing wasn't really good. Because when I came here, I actually didn't listen to her at the beginning. I was ordering pizza constantly and drinking soda all the time. And to a point that she told the kitchen that if this guy comes and orders like tea or anything with caffeine, don't sell. And I know, of course, she was looking out for me. I wasn't upset at all. Actually, that's something that you want. You want someone to care. So I told her, you know what? I don't know what to eat. You order for me. So I told her that you can order food for me, whatever you pick. I just don't like to eat this and that. Besides that, and she did. And after 2 weeks, when I did my X-ray, I couldn't believe it. Like it was really, really good. So first, you might think, well, it's really not that big of a deal. It's really not gonna make that big of a difference, but it really does. Like I saw that with my own eyes when they showed me the X-ray. They're like, okay, see, this is the X-ray from 2 weeks ago, how bad it was, and look at this one. So, and then it encourages you to eat healthier when you see the results. And then I lost my appetite, and she actually suggested something like a syrup that I kind of got my appetite back. And also because there's some food that I can't eat, she recommended supplements, so I'm really happy with it.
And we can see really different, right? I mean, 2 weeks before the bone healing with X-ray. Wow.
Generally, the first X-rays is good.
Yeah, of course. Because of osteotomy and...
Yeah, but after 5 centimeters or 6 centimeters, we can see the bone healing better. And generally, patient think, looking at first X-rays, first and second X-rays, yeah, but my bone healing is good, forget about the nutrition. But I always say to patients, no, it's you lengthening just little now. Keep going like that. Nutrition is still important for you. After 5 centimeters, after 6 centimeters, you are gonna see it, and you're gonna say, look, my bone healing, what can I do about nutrition like that. So it's really important from the beginning to the end.
Okay. And Özlem, you are our head nurse. I know it's sometimes too much stress because you're always with the patient, maybe 2 times, 3 times a day. What do you think your job, how can I explain? What do you think? What is the most important thing in your job? What is medical team, I mean the medical support for the patients? What is the most important thing and how you support the patient?
I think my most important responsibility is the patient's health, you know, because physiotherapy cares about the physical health and nutritionists care about the intestinal system care maybe, but I care about everything. The patient.
Okay.
You know? I mean, I'm working on everything to be honest. All patients come to me first. I have a problem like that. Then I call the people, and I have to decide what is the exact problem. I have to be careful about that part. For example, the patient told me, I have stomachache. Okay, it's okay, but why? You have that stomachache. Did you eat some wrong thing, or you didn't take your medications, or you did take too much medications, or you already have some systemical problems, but you forgot to tell me. That part is really important. And I have to decide quickly, then do something about it. The most important part is this, I think, to be honest. And our patient is a nurse.
Oh, wow, okay. You're an expert, huh?
Yeah, like me. And the other important thing is pain, of course. This is the really most popular question about patients. Every patient asks same question to me, do I gonna have pain? And I always say, yes, you are gonna have pain.
But I have a question to you. Can you really kill the pains?
I can.
But how?
Yeah, with the medications and also working with the physiotherapy team, because this part is actually 2 parts. I mean, treatment of the pain, physiotherapy and medical treatment. For example, for the muscles, I can give some muscle relaxant, that's not the problem, but and also unit physical therapy. Sometimes the patients tell me, I have too much muscle pain, and ask that question. Did you go to your physio session? And they say, no, I didn't. Why? Because I slept. No, you shouldn't.
Exactly. I want to say here something important because I talked after the surgery, okay, pain, you have pain, painkiller. You can use painkiller, that's all. But the first week was good, the second week was good, but after that, I use painkiller. I have still pain, you know what I mean, after the pain. Then I understand, okay, the painkiller is okay, they will support you sometimes, but you need definitely mobility, flexibility.
Absolutely.
And I understand after that, the painkiller is mobility, flexibility. When you walk too much, when you have mobility, when you have flexibility, you know what I mean, when you are not lazy, believe me, it's a natural painkiller. And as a patient, I can say that, guys, painkiller is just maybe, you can take sometimes when you cannot sleep or when you have some tensions, something like that. But here is really your walking and physiotherapy support really important. But of course, painkiller is also after surgery, especially after surgery.
And another part is infection.
This is the most question, by the way. Can you explain a little bit about infection?
So what is infection? Okay, as a book, we have to see 3 things for decide about the infection: the redness, the high fever, and sensitivity around the wound. But after that surgery, every people shouldn't forget that we are doing something in your body, in your bone. Of course, your body has some reaction. Your body has to show some reactions to us about that surgery. And we see some infections, something like superficial infections, some skin infections. That's totally normal because you are growing up with your whole body. Your skin, your muscle, your bone, and I think you had that experience in here also. You had the second infection in here, just maybe a few days.
Wasn't really an infection, so they said it might become an infection, something like liquid came out of it, and even before it was a problem, it was resolved. So they
that's why we check all patients every day, bandages. If we see any problem, we have to solve that problem at that time. If we wait, okay, just wait, it's gonna be okay. No, it's not gonna be okay.
Oh, it could have been worse, absolutely.
So that's why we always check the patients This is infection and also inflammation at the beginning of infection.
True.
So if we see any problem, we have to do something about that problem. And so if we stop that infection at the true time, nothing gonna happen on you, on all patients, you know that. Yeah, we had that experience. And another important thing is also chronic disease. We ask the patients every time, you know, do you have any chronic disease? Sometimes patients forget to say something, and we find the problem after the surgery. And this part is a little bit hard for managing. You know, you have a chronic disease, something like asthma, you know, and if you this is important for all patients. If you tell me your all problems before the surgery, I can manage it. We can manage it in here with the team. If you don't tell me your problems before the surgery, we cannot manage it. How can we know your problems?
Right.
We have to trust the patients, and patients have to trust us.
Exactly.
Right?
Exactly.
So, yeah, for example, he has a chronic disease, something like asthma. We already know that problem. And if we see any wrong things, we can go to pharmacy or we can go to hospital, anything else. We can do everything on patients.
Supervision is the most important thing. And to be honest, when we talk with the team together and when we have team meeting, we say always it's really a teamwork. This is really teamwork. Without teamwork, forget limblengtheningsurgery, to be honest, because imagine the physiotherapist, nutritionist, nurse have to work each other, you know what I mean? So, for example, when you not eat too much, you cannot, when you didn't care about your nutrition, you cannot take any painkiller or some medical medicine. So, and then you can get, because of your immune system, you know what I mean? Your immune system is low, so the medicine will don't help you. And what's happened? You have infection, for example. Because of infection, you cannot do the physiotherapy, and your recovery will be late. Maybe we have to finish earlier, you cannot reach your height, and blah, 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 some other things. And as you can see, it's a teamwork, to be honest. And important is here really to understand this. Limblengthening surgery is, of course, everything it's risk, everything it's not easy, but you can decrease seriously the risk when you are under supervision. For example, you was here, I was alone, you know what I mean? And I saw that, and for me, my first surgery was really painful, to be honest. And I had 8 times superficial infection. Wow. And I lose so much weight, by the way, 15 or 20 kilogram. And it was really, really painful. And even with my pain, I did 2 and more time, you know, the second and the third surgery, but because it was my dream, and I say always all or nothing. But it was hard. But for you, you say, for example, easy.
A lot easier. Absolutely.
And pain, maybe, I don't know, can you...
is there pain? Yeah, of course there is pain, but there's pain
from
in
1 to 10?
The hardest, because it's not always the same. Usually, it's like
2 or 3.
But
okay.
sometimes, some nights, especially because it gets worse at night. It's usually muscle pain. It becomes like 6, 7, something like that. But then
there are medication for it.
That brings it back to 2 or 3. So, the pain
Is not to a point that makes you regret your decision. It's really just there and definitely manageable.
The pain is like, for example, at the night when you say 6, 7, how you can explain the pain? So
It's more
like crying or?
No, absolutely not. It's like more of a nerve pain. Because of your muscles are stretching, it's kind of a good pain because you know the reason that it hurts is because you're getting taller. You know the reason, so it makes it more tolerable. It's not to a point that you're crying. It's just to a point that you might not have a hard time falling asleep because of the pain. But then you take a medication, like a painkiller, and then you sleep like a baby. So it's really not that big of a deal at all.
How was it for you after the surgery? Directly right after the surgery?
After surgery was super easy because they put you on super
strong pain medicine
at the hospital, so you really don't have any pain actually. Whoa. So it's that's funny because the part that I was afraid of the most
was the easiest part at the hospital. The surgery part. You really don't feel anything. You're unconscious, and when you wake up, you have an IV on. They give you pain medication and everything. And by the time I left the hospital and to come here, I wasn't in any pain.
And the pain only started after about 5 centimeters. It gradually started at the beginning.
I want to ask you one question as a patient. How can you explain me the feeling? How is that you reach your goal?
It feels really good.
Right?
Absolutely.
So maybe, I don't know, for example, I'm this kind of guy, for example, when I say 10 centimeters is my goal, and when I reach only 8, it's for me like, I never did the surgery, you know, or something is missing.
No. I mean, so like 8 centimeters and 10 centimeters, it's really not that big of a deal.
Yeah.
I mean, you have to listen to your body. So it's good to have a goal at the beginning. You say, okay, I want to become 10 centimeters taller. But honestly, if you see 2 people, one is like 1.5 centimeters taller than the other one, you can't even tell the difference. So just listen to your body, see what your body tells you, because your body tells you when you need to stop if it comes to a point. And for me, I wanted to reach 10. I could have, but after 9.3, I was happy with it. It's
9.3.
9.3,
Okay.
and I stopped.
Some doctors say 8 centimeters is a medical green zone. What do you think about that?
So honestly, I don't believe in it because what they explained to me here makes more sense. You can't really put a number. As you said, it's biology, not math. So you can't put a number on it.
Yes.
You have to listen to your body.
Exactly.
Somebody might even do it 15 or 12. It doesn't matter.
Yeah.
But whatever your body says. Maybe 8 centimeters is too much for someone. Maybe 10 centimeters is not even enough for someone.
Exactly.
It's all your physiology.
I say that always also our physiotherapist, medical green zone is your body, guys. It's your muscle and everything. It's not a number, it's not a centimeter, it's not a meter, I don't know.
100%, absolutely.
Yes, so as we can see, this is really a teamwork. It's easy, but it can be also difficult, right? Okay, and you can also show later, I mean, the body analyze, but not now. I mean, just we want to talk about quickly your body analyze and then
Basically, you are like non-fat now.
Good.
Non-fat and muscles. Yes, it seems here like you have lost all the weight from fat, not with muscles, and this was our goal. So, and 6% of fat you have now, and it's under the range. Actually, you should gain some fat mass for living function. It's okay if you gain some weight. You have a little bit swelling, that's also okay. That's the thing that we expected, it's okay. But you should drink more water. But your total body water is okay. And your body is balanced. Maybe physiotherapists can make a better explanation about it. After lengthening surgery, after the lengthening, it's really good to see your body like that in balanced way. And when we can look your, for example, leg fat, leg muscles, we can see the balance also there. Okay, and also your body fat is nothing. It seems here we can protect your muscles. We prevent just loss of muscle mass.
we can say it's not only limblengthening, it's also liposuction, huh?
Exactly. Exactly.
I mean, 2 in 1, huh?
Buy one, get one free.
We can see the bone mineral density here, and it's also good according to your weight, according to current situation. It's also good after limb lengthening surgery. That's an advantage for bone healing also. It's like this, everything looks good.
It's really, I want to say something, that balance, it's really important. And again, same result, why physiotherapy is really important, why you must have some professional team. We are doing recovery and lengthening at the same time. That balance, because it's also asymmetric. You also felt, I'm sure, the different pain on the left side and on the right side is always different.
Absolutely.
But that balance is really good result. Now you can recover so fast because your body now know how can walk, how can use your balance, your legs. It's really so important for us, for physiotherapy part. Of course, it's also good for you, but it's really so good. I'm so happy you lose fat, but not muscle. That's mean, again, we did recovery also with the lengthening. And now it's, again, same result. You can get recovery so fast and so soon. It's also your muscle just need a little bit flexibility, but your muscle strength is really good, and you can walk after some little bit flexibility. You know, it's really so important for us.
Tuba, it's really important what you say. So, lengthening and recovery at the same time. Can you explain a little bit what you mean?
Normally, okay, you got surgery, and after every day, you doing some lengthening. Your muscle must adapt that situation. Your muscle can get longer. Your muscle your also tendons, everything, everybody getting longer, and must adaptation, but not just getting longer. You know, it's also must adaptate to walking the same normal gait. It's also important. With also we using so many devices for that, not just the stretch. It's after 100 bending, but doesn't matter. You can't walk the good posture. You can't walk some normal gait. It doesn't matter. You must walk also with normal posture, the good posture and normal gait. It's the important thing. And we always support from nutritionists, from nurses. We always working together. Also the physio team, this Engin worked so many times. He had some problem for the IT band, right?
Yes.
We fix that, not 100%, maybe I remember, but we can get also under control. It's important. Body can get so many different body here, but the important thing, how you can take control. It's the important thing, and we did really good. I'm so happy, and I'm proud of you.
I appreciate that. Thank you.
It's really good result.
Thanks to you guys.
Thank you, Tuba. By the way, my problem was exactly first lengthening, and after 6-8 months recovery, just lengthening, just reach my goal, and this is really wrong. And unfortunately, many doctors or many other doctors in the world do that also. Okay, I did your surgery, go home or go hotel, and this is really dangerous. This is really, really dangerous because this kind of surgeries need supervision, you know what I mean? You have to be under supervision, and everybody have to care about your medicine, nutrition, and physiotherapy. You can't do not alone, to be honest. Because before the surgery, you are focused on the goal, and you can see your future. You know what I mean? Okay, I'm 10 centimeters taller with trench coat, and you know. But after that, after the surgery, oh my God, okay, it's not easy. And when you do the surgery really alone or without any support, of course, it's really hard. And I had the same problem, by the way. Yes, guys, really thank you, and I hope the best for you.
Thank you so much.
I wish you the best and enjoy your height.
Thank you. Thanks.
And one question: do you think about the tibia? To be honest,
actually, I am thinking about it. Absolutely. I'm thinking about it. Yeah, I was actually talking to one of my friends, and because I took some pictures, he was like, "Do you regret your decisions?" I'm like, "My only regret is not doing it earlier. In fact, I'm going to do my tibia too."
I said it is. And one last question to you, Sam: can you imagine the surgery in a hotel or home?
No.
You are a nurse. You know that better.
Absolutely. I know some doctors do that, and honestly, I don't know how they can do that because it's like ethically, it's not. Like if I were a doctor, I would not do that for no amount of money. You need nurses to check on you constantly. You need physical therapy constantly. You need a nutritionist. And honestly, it's a lot. The medical care that you get here is by far better than what I've seen in the United States. I've been a nurse for 12 years. I worked at hospitals. I worked at nursing homes. I worked at rehab facilities. Like we have like nutritionist that is for the entire hospital, comes and gives everybody like a recommendation. That's it. You want to take it or leave it, do it. No, not like here that comes every day to check on you. Hey, did you do that or not? And work with you. This is like next level. Something that you get. And I told in my interview, my first interview, that before I came here, I didn't know what to expect because I thought the United States by far has the highest medical standards. And boy, was I wrong. This is like by far the most professional place I've ever been at, and I highly suggest that. And also I wanted to suggest one thing. it's not the most complicated surgery, but it's not a very easy surgery either. So if you want to do it, you want to do it at the hands of someone who knows what you're doing. And Dr. Halil Buldo is more than qualified. He's done so many patients. I've seen so many of his patients. I've been a patient. You've been a patient. And I highly recommend him.
Thank you, brother.
Yeah,
Thank you.
No,
Thank you
thank
for
you.
your support and cooperation also to the patient.
Of course, you're
appreciate it. And by the way, thank you guys. Thank you for your cooperation as well. Özlem, Meltem, Tuba. Thank you.
You're welcome.
Enjoy your height.
I appreciate
We can
it.
say now official. Live like
Taller.
taller. Greetings from Istanbul. Thank you. Bye-bye. Thank you, brother.
Evet.
Ne yedin?
Lahmacun.